Hi everyone. In today's class, we are going to discuss one interesting topic that is cryotherapy. Okay, so I think you might have heard heat therapy, hot therapy, and like that. Similarly, there is therapy that is called cryotherapy, which is called cold therapy. Okay, the reason of this particular therapy is that if you, irrespective of any temperature, whether it is high temperature hot therapy or low temperature cold therapy, cryotherapy, the main motto of this kind of therapy is to give pain relief. Okay, so to enhance the healing process. So that's why this type of therapy is called, which comes under category of treatment, that is a therapeutic equipment. Okay, so cryotherapy is one of the technology or the technique which is come under the category of therapeutic equipment. So there is a diverse field in hospital side. One is diagnostic field and one is therapeutic field. So this particular topic which comes under the category of therapeutic field. Okay, since it's giving treatment in some sort of pain relieving on enhancing the healing process. So this will come under the category of therapeutic equipment. Okay, so not only heat or cold, there are various physical agents which they have been used in treatment process in case of therapeutic side. In addition to the heat and cold, we have water, pressure, sound, and electric current. Okay, so anyway, this water, pressure, and sound, which either we are using directly or indirectly. Again, we are using these particular physical agents for treating the pain. On electric current, we already know we have two types. One is TENS, okay, and then NEMS, that is neuromuscular electrical stimulation current, or TENS, transcutaneous electrical stimulation current. So by passing the current, we are treating the pain. Okay, so these are the few physical agents they are focusing on. They are using in one or other way in order to treat the pain. So let's see what is the indicate what is the what we can also see what is the importance of having these particular physical agents, why we want to use in case of treating the pain. In the sense, these are the reason. Okay, like the this kind of physical agents can modulate the pain, either it can reduce or eliminate the inflammation, increase the healing process, and modulate the muscle tone, and even increase the continuous tissue extensibility. Okay, so the main major focusing thing is that inflammation, irrespective of any treatment, we will like if the patient is have some kind of some sort of injury, whether internally or externally, the first symptoms the person will have is inflammation. Okay, so the basic concept of inflammation, we should know why it's actually happening, whether it is a good sign or bad sign. Okay, so if it is good sign, then what kind of therapy we have to go. If it is a bad sign, means what kind of therapy we have to go, then only we can decide. So that is the reason we have in this class we just going to see what is the impact of inflammation, what is the actual mechanism is happening during inflammation, everything. Okay, so the inflammation is happening in two ways. One is acute inflammation, another is chronic inflammation. Acute inflammation is is the thing which is happening when you have immediate injury or a immediate burn. It will not persist for a long time, which is it will it will get rid out of it within few minutes or seconds. Okay, so in this case we have other signs like all over other signs in area of inflammation is that you can feel like heat, warmness in that particular area. It seems to be like so redness and swelling. The accumulation of fluid will be there during inflammation, and pain also there, because at the damaged site there is a chance for the nerve to get damaged, the pain nerve. So through that the signal gets goes to brain. So the brain perception will be there. So as a result, you have the sensation of pain and loss of the functionality. Based on severity of the damage, even they have cell functionality loss. So these are the signs you can see during the acute inflammation. So if you see the diagram here, the first two diagram is all about the normal in case. Okay, in the second one is it's a case during the inflammation. In a normal case, the blood is having a normal axial flow direction in from atrial to veins through the network of capillaries. Okay, so this axial movement is maintained by two pressure. One is hydrostatic pressure, another one is colloidal pressure. So these pressure has to be maintained in proper way so that no fluid, that is extracellular fluid or intercellular fluid, is not exchanging or it's not leaking out. It's there in their own position. Okay, because of this pressure balanced. And also we have so many molecules, we have so many proteins, so many hormones, colloidal particles are there, right? So again, if you want to maintain this colloidal particle to their respective place, we need the pressure is called colloidal pressure or colloidal osmotic pressure. So these pressure will maintain their respective molecules in their particular area. So it means that the hydrostatic pressure and colloidal pressure has to be to be normal balanced way, so that everything is happening normally, everything is flowing normally, no one is going from their own position to the other position. So this is for normal cases. If you're coming into the inflammation, so inflammation is like is thing is that immediate after injury, the first sign is that symptom is that inflammation. The patient will get inflammation at the damaged site. The reason is that the inflammation is the sign or the symptoms is it's usually called as first line defense mechanism, because this is the thing which will start to initiate in order to repairing the process, repairing the damage process. So it is called first line defense mechanism. Okay, through the inflammation, how the inflammation process happening in the sense, immediate after injury, the blood vessels will get ruptured. Okay, at the damaged site. So what happen, this damaged site will release, okay, the collagen fibers, the damaged site of collagen fibers will start to release some histamine signal molecules. These signal molecules will give signals to the blood vessels to get dilate. Okay, so the in when it's get dilate, the size of the blood vessels get enlarged, so the more blood flow will increase. Okay, the more blood will get flow. So what will happen, inside the hydrostatic pressure will increase, since the volume is getting increased, the pressure, the blood is also going blood flow is also be increasing. So what happened, the hydrostatic pressure inside the blood is keep on increasing, which push the molecules, that is called WBC. That is the main for defense mechanism, right? So it pushes the WBC because of high hydrostatic pressure, which is happening because of vascular dilation, which is given by the which is initiated by the histamine signal, which is being released again by the damaged site. Okay, so this WBC cells now will expelled out from the blood vessels because of this high hydrostatic pressure to the targeted area. So this is in this way only the WBC cells, okay, either it's a lymphocytes or macrophages, will move to the targeted site, and where they it start their reaction of killing or repairing mechanism, killing foreign particles or repairing mechanism of healing process. Okay, so in order to go or to push the WBC cell to the targeted site, we need the process called inflammation. So since the it's flooding out, the blood is getting fled out over there, so that seems to be like swelling. So we used to call this, that process is called inflammation. So this is a very good sign. So then only the defense mechanism will be take over. Okay, but this inflammation, it should not be prolonged for more days. Okay, so that's why we have two types. One is acute inflammation and chronic inflammation. Acute inflammation will not persist more than 1 or 2 days. It will get over once it done with it work. Okay, that is a different mechanism work. If it is chronic proliferation, we have to reduce the inflammation. Okay, so it should not be prolonged over the way. Once the work is get down, it has to restore its normal functionality. So in case of chronic inflammation, it is not happening in such a way. That is the reason we are going with some kind of treatment. Okay, that is a therapeutic treatment by using some physical agents in order to reduce the inflammation and enhance the healing process. Okay, So this is the overall mechanism of inflammation. So that by understanding this, whether it's acute inflammation or the chronic inflammation, we have to decide which type of physical agents we have to prefer for treating.